This meeting is being recorded.
Hi, everyone. Thank you so much for joining us. I'm just going to give it a few seconds for everyone to get settled, and then we will begin. All right, so we're going to get started. Thank you all for joining us for the Skilled Nursing News Staffing Summit. I'm Shelby Grebin with Skilled Nursing News, and I'll be moderating this session, 5 Things You Can Do Now to Combat Employee Turnover. Before we begin, I want to say thank you to our thought leadership sponsors, ShiftKey, Pinnacle Quality Insight, ShiftMed, Reference, and to our awareness sponsors, IntelliCare and Century Rehabilitation. We welcome questions from the audience at any time. Please submit your questions via the Q&A function in Zoom. And if you miss any of the sessions this week, the recordings will be posted at the conclusion of the series and will be available for 30 days. Our speaker today is Chris Magleby, CEO of Pinnacle Quality Insight. Chris has been involved in senior living and skilled nursing for most of his life. He is currently the CEO of Pinnacle Quality Insight, a customer and employee insight company whose surveys and software show senior care and senior living providers what to celebrate and where to improve. Pinnacle reduces employee turnover using simple software that surveys employees and guides managers in recognizing accomplishments and addressing issues. So now it is my pleasure to hand things off to Chris.
Okay, great. Thanks, Shelby. First of all, I want to say thanks to Skilled Nursing News for hosting the Staffing Summit and for having us be part of it. I know there's been some great speakers so far, and hopefully, as we've all been dealing with staffing issues for the last few years, that there's been some insightful things that you've learned, and hopefully this session continues that. So today I want to talk about 5 different strategies that we can do to try to keep our employees. So we'll be talking about employee retention. Before I get into that, we have a lot of really interesting data that I want to share with everybody. So here at Pinnacle, we measure customer satisfaction levels, we get customer satisfaction feedback, and we also do employee engagement, employee satisfaction surveys, specifically for senior care and for senior living. So we exclusively serve the aging services field. And we've got some interesting sets of data that comes from this sector about that kind of illuminate some things that are happening across the US and specific with healthcare, and then even more specific with post-acute and long-term care. So I kind of want to go into some of that and hopefully share some interesting stuff. Before I do that, I'm just going to tell you guys a little story about me. So this is my youngest son. His name's Jude. This picture is a couple years old. He just had his 7th birthday in this picture. He was about 4. But Jude is kind of a crazy person, and he likes to get into, he has a big personality. Doesn't get into that much trouble, actually. He's a really good kid, but he's has a lot of energy. And Jude, when he was little, he had a couple instances where he put a Lego up his nose. And so I don't know if any of you guys have kids, or if any of your kids have stuck a Lego up their nose, but my wife has learned how to get Legos out of noses because, this is our 3rd kid. So we've had several Legos in noses throughout our parenting journey. And if you don't know, what you do is you plug the nostril that the Lego is not stuck in, and then you breathe real quickly into their mouth, and the air will force the Lego out of the nose. So if you don't learn anything else from me today, I think hopefully you'll learn how to get Legos unstuck from kids' noses. So anyway, my wife went to do this, and she blew the Lego out, but it didn't come out. And so he had got it up there pretty far. So we had to take him to, this was a Sunday, So we had to take him to, gosh, we went to a couple different places. We took him to like an urgent care kind of any hours place. It wasn't to the hospital. It was just to an urgent care place. So we take him there. They're trying to get the Lego out, and they're getting they're up in there trying to get it, and then all of a sudden it disappears. So they get kind of concerned that this Lego has disappeared from his nose, and they're like, well, if he's inhaled it into his lungs, that's going to be a problem. So now we've got to get him admitted to the hospital, and we go over to the hospital. This is now Sunday evening. He's kind of feeling fine. He had a little bit of a bloody nose, but he's fine. But now they've got to put him under, and they've got to do a scope to search for this Lego. And so we admit him to the hospital. He gets put under. They do the scope, and luckily there's no Lego in his lungs. But this whole time, they knew they had to do the scope, and if they're going to put him under, he can't have anything in his stomach. So he's had to like fast and not eat all day. So he's getting kind of grumpy because he's hungry, and has been fasting all day. And so finally we get like discharged at, I don't know, 10 p.m. Everything seems to be fine. He's able to drink and eat again, and he's in better mood. We get home, and all of a sudden in the middle of the night, he comes screaming into our room at like 2 a.m. and is holding his abdomen, is screaming at the top of his lungs. And so we're really concerned. And I've never seen him scream like this. So screaming really loud. We rush him back to the ER. They can't figure out what's going on. After a while, he calms down. He's back to normal. We go home. So then what happens is we get home, and for the next 6 months, we keep having episodes like this, like every, I don't know, 6 weeks, where all of a sudden he's screaming, he's holding his abdomen, and now he's starting to get, he gets blood in his urine. And so we're going to kidney specialists. We're trying to figure this out. We're like concerned that there is a loose Lego somewhere in Jude, and it's causing some damage. Nobody knows really what's going on. This could be unrelated. It could be a kidney problem, but he's having these really bad episodes. And so finally, we take him in during one of the episodes, and even though they had ruled out kidney stones in the past, come to find out that's what it was. And so you can see right here, he's got this huge kidney stone that they weren't able to see until they did this CAT scan on him. And the Lego happens to be completely unrelated. So we all think there's a Lego stuck in him, but it turns out that when he was fasting and going through all this, it just kind of made this kidney stone move, and it started to move. And so we took him into the hospital. And this was after this big, long journey. It's been really stressful on us. We've been really worried about him. It seemed to start with this Lego in the nose, but really this was a kidney stone that's probably been forming since birth, and they're going to remove it. But it's a pretty big kidney stone. He's just a little guy. So Mom and I are really pretty nervous when we take him in to get this procedure, because he's had such a hard time over the last 6 months. He's been bleeding a lot, and we couldn't figure this out. We're a little worried. They give us this one, when we admit to get this procedure done, they give us this card, and I took a picture of this card, and I think this is really, we really appreciated this. One thing they asked you is, what's most important to us today? What's our top priority concern? And is there anything else that they wanted us to know about us or our child? And one of the cool things was that every time anyone came into our room before the procedure, this card was pinned to the wall, and whoever came into the room would take the card down and would read the card and would mention the things that we had written down on this. This was like a plastic card that we wrote on with, dry erase marker, and then they could erase it and use it for the next patient after us. But everyone that came in, even the maintenance person, came to check on the lights or something at one time, and he referenced the card. But everyone that came in would always reference the card, making sure they knew what was most important to us, if there's anything else we wanted them to know. And we felt very taken care of. We knew that we could write some of the things that we were concerned about the procedure. I was concerned about him going under again, because last time he went under, it kind of triggered all this stuff. And I thought maybe, does he not respond well to some of the anesthesia? And they were able to address some of my concerns. And so this was an experience that I thought was a very good customer experience for us. And since I'm in the customer experience measurement field, this really stood out to me, and it was something that I really liked. And so one of the things that I want to point out is, in order for that to work, there's a lot that has to be working behind the scenes. In order for this card and for the staff to have communicated with us, there's a lot going on behind the scenes of the staff coordinating with each other. They're getting trained. They know about this card. They know to ask about the card. And a lot of that comes from staff continuity. And so when we're talking about our staff members and the workforce crisis, and we've been talking about staffing, a lot of it comes from the perspective of how can we work on staffing, because staffing we're working short right now. It's hard to get enough staff. It's very difficult, but it's also staffing and having longevity within your staff is not just takes pressure off the managers that they don't have to find people and fill shifts, and it takes pressure off the other staff members who have to fill in for other people that aren't there. It's also very important to your residents and to your patients, to whoever you're serving, in the continuity, in the the levels of care they're receiving. Having that continuity of staff is very, very important for how you treat your residents and your patients. And so, this was just one little experience that we had from kind of a pediatric standpoint. But another quick story I'll tell you. I was at a concert earlier this summer, and this is Andy Grammer. And as part of his concert, he brought up, this is some of the staff. I'm in Salt Lake City, Utah, and there is a children's hospital here called Primary Children's Hospital. And this is some of the palliative care team at Primary Children's Hospital that he brought up on stage and sang to them. And he had been visiting with some of the kids the night before he performed. And one of the parents of one of the kids there was talking to him, and he said, "You don't understand how these people are. Every night we have to leave our sick children here in the care of others, and this is very difficult for us. And these people that care for our children, they're actual angels." And that phrase got me thinking a little bit, and it got me thinking about the people who choose to be in this profession, who choose to be in healthcare, and why they do it, and the roles that they're filling. And so I would challenge every one of you who's on this webinar today to think about how you think about your staff members, to change it a little bit, to understand that to your residents and to their family members, though your staff members are actual angels who are taking care of their loved ones when they can't do it themselves. And, if you take a second and you talk to your staff members about why they're, try to understand their why they've chosen this profession, why they've chosen this career, you're going to find out some interesting stuff. It's usually, there's kind of a calling to this profession. I'll bet a lot of you that are attending this webinar right now have something similar. There's a reason that we're in this line of work, is because we care about others and we want to try to take care of others. And when we care for others and help others, it is fulfilling to us. And that's very important, because it can change our outlook on how we treat our employees, how we're taking care of them. That if we have this mindset that they are actual angels and taking care of our loved ones when we can't, that's one thing. And the other thing that you can do is you can understand that this is not all about money. And so a lot of things that we are facing with the workforce shortage and with turnover over the last 2 years, we've seen a big inflation numbers. We've seen wages going up. There's competition for employment. And you have to remember that these people in healthcare, they might get they might get offered more pay somewhere else, and they might be tempted to take that if they're not feeling fulfilled in their job. But if you can help them feel fulfilled, if you can help them understand the purpose of caring for others and getting fulfillment that goes beyond money, that is something that's going to help you. That's a resource to you. So or maybe resource isn't the right word, an asset to you, is that the people in this field are doing it for a reason beyond just the money. The money's important. We have to have money to survive. They're going to need to get paid. If they get a big job offer that's a lot more money, yeah, some of them are going to take it. Most of them are. But if we're talking a little bit of an increase, but the job's not going to be as fulfilling, as long as the job that you're offering and that you're providing to your employees is fulfilling, that's going to outweigh sometimes some of these financial factors. So as we just kind of keep some of this in mind of the attitude we want to take towards our employees, how the employee continuity and how the employees translates into better care for your residents, and how it translates to higher satisfaction levels for the residents and for the family members. So this is something that I want to show you. Like I said, we measure customer satisfaction in this sector, as well as employee satisfaction and engagement. And there's some interesting things that we can learn. This is satisfaction rates from 2018 up until 2022, Q2 of this year, 2022, for across this segment of healthcare. So the dark line, the top line is independent living, then the blue line is assisted living, then we have short-term SNF at the bottom, and then long-term SNF is the green bar there in the middle. And so if you look at long-term SNF, assisted living, and independent living, you can see that they kind of mimic each other. They seem to move at about the same pace throughout the last 4 years, up until, even throughout this point. This is Q2 of 2020, and in Q2 of 2020, I'm sure you all remember, that's the onset of the pandemic. And a real interesting thing happened with resident and family satisfaction rates during that time. You can see they all peaked. As difficult as that time was for all of our residents and their family members, this is the highest satisfaction level that we'd seen in about the last 10 years for long-term care, SNF, for assisted living, for independent living. There's big peak in resident satisfaction. And a lot of that was because they really appreciated the response of the industry to the COVID pandemic. The elderly were the most at risk for COVID-19, as you guys know. And one thing I like to point out to everybody who attends these webinars is that they go back to their staff members and they thank them, because they really did a lot to respond to the pandemic and to take care of our frail population and our seniors. And we really want to make sure that everybody who's involved in that knows how thankful we are as a community to them for everything that they did. Then as the pandemic weighed on, you started to see some satisfaction rates dip a little bit. Up until this point, assisted living, independent living, and long-term SNF, they kind of mirrored each other. There's some ups and downs a little bit. You can see long-term SNF had a bigger dip in Q4 of 2020 than the other sectors did, but they really, they kind of moved together up until this point. And then you see a separation of independent living from assisted living and from skilled nursing. In independent living, they have kind of completely recovered from the pandemic, and their satisfaction rates are actually higher than they were pre-pandemic. And so independent living is doing really well, but assisted living, their satisfaction rates have started to dip, and so has long-term SNF since Q2 in 2021. Now, the reason for that is, Q2 of 2021 is when we really started to feel the workforce shortage. And so independent living, those residents, they don't have as much interaction with staff. They're not relying on the staff for their activities of daily life. They don't need a lot of interaction with the staff. They really just need a place to stay, and then they have a little bit of interaction with the staff. In assisted living and in SNFs, there is a lot of interaction with the staff, and the staffing shortage started to really pay a huge effect. And so much so that you can see that here towards the end of the graph, these satisfaction numbers are actually lower than at any time during the pandemic. So at the first, we had a spike in resident satisfaction levels, but as the pandemic waned on, the levels started to dip as the visitor restrictions kept going on. There was some difficulty. There was a lot of difficulty through the pandemic with PPE, different things like that. But the data is showing us that residents and family members are having a harder time with the workforce shortage than they even had with the pandemic. And so that's something that we want you to understand, is that they're having a hard time. And the second thing is, they don't completely understand the workforce shortage. They understood the pandemic. They knew what was going on. Everyone was talking about it. The workforce shortage, that's a foreign concept to some people, especially the older generation. All they've known is, the opposite of a workforce shortage. What they've always known is a job shortage and more workers. There's always been more workers than there were jobs. And for the first time in a lot of these people's lives, they're experiencing, more job openings than there are people. That doesn't make sense to them. One of our survey respondents in 2021, they said, they keep telling me they're short on staff. Damn it, hire some more. It's just that it doesn't make sense to them. It should be pretty easy to solve this problem. We'll just go hire more people. We have to explain to them there aren't more people to hire. And so, things could change as the economy starts to slow a little bit. It's taking a little bit of pressure off of the workforce shortage, which will be welcome. Some of the recession is not welcome, but some of the workforce shortage problems easing will definitely be welcome. But one thing that we recommend to everybody is to explain to your new admissions, to your new move-ins, what's going on. Tell them that there is a workforce shortage, that you're working very hard to get more staff, but please be patient with us. And, understand what's going on. Try to set expectations, because a lot of them don't understand this. Let them know you're looking for people. If they have anyone that they want to refer to you, do you have any employee referral bonuses, anything that you could offer them? So setting expectations is really important. Okay, so some other interesting pieces of data that we have access to. One of the pieces of software we offer is called Retain, and it helps retain employees in this sector of healthcare. And the way Retain works is it connects into the company's payroll software or to their HR software. And from those two pieces of software, we pull in all this data about their employees, and then we start communicating with the employees. Well, because we're pulling in all this data, we have access to a lot of employment trends across a big segment of the population in senior care. And so we have records on over 300,000 employees from senior living and from post-acute care about what's going on in the sector with employment. And as we started looking at some of that data, we found some things that were very interesting. First of all, we went and we looked at the tenure of employees when they separate from employment. And we looked at this data in 100-day segments. And so if you look at this graph, you can see that the majority of turnover is happening in the first 100 days of employee tenure. And then after they get past that first 100 days, there's a huge drop. It drops, more than half in the next 200 days. And then after that, there's another huge drop, and then it tails off. And so we've learned from looking at this data that's specific to senior care and senior living that there is a big problem with our new hires. we hire somebody and then we're having a very hard time retaining them through the first 100 days. If we can get them past those first 3 months, those crucial first 100 days, the chance of their turnover starts to go way, way down. And hopefully this is resonating with you. Hopefully you're seeing this in your operation and yeah, we do have a problem when we hire new people. It's almost 40% of every new hire does not reach day 100. And so that's a big chunk of our workforce that we're investing in finding new employees, in training new employees, in onboarding and getting them all set up, that investment is not even lasting 100 days. And so we looked at this and we thought, is there any way that we can help this? And just to kind of drive this home a little bit, this is some information from American Healthcare Association. And in skilled nursing, since January 2020, we've lost almost 240,000 jobs during this pandemic. And so there's a lot of people that have left the workforce, and a big chunk of this is coming from our new hires. They're not sticking around, they're not making it. And this is a problem that is kind of unique to our sector. I know there's other sectors that have this problem, but if you look at the US on average, it's actually very different than what we're experiencing. This data on the left was published by Harvard Business Review, and it shows that when people leave their jobs. And you can see that there is a spike in the first 3 months, but then separations remain kind of high until the first year mark. And then that's the biggest point of turnover on average in the US. And then turnover starts to go down a little bit, and then it spikes again at 2 years. And then after 2 years, employee turnover goes way down. And if you contrast that to the graph on the right, that's the long-term care average. And so you can see that we have this huge spike in the first 3 months, but then after that, it starts to really go down. So you can see there is a little bit of that at the 6-month time period, but then it really trickles down. And by the time you get to well before 2 years, turnover is very low. So I've got a friend that works in investment banking, and his bank has an initiative in place where they are trying to keep their new hires for 2 years. They know if we can keep our people for 2 years, we're going to have them for a long time. The chance of them leaving after 2 years is very, very low, and they kind of become lifers there. And so in our sector, we don't have that same, you can see on the left here that after 2 years, this number goes almost down to nothing. We always maintain a little bit of turnover in our sector. We don't go down to nothing like some of the other industries do. We always have a little bit of turnover because this is it's a hard job. But you can see that if we can kind of usher people through the first 3 months, their chance of turnover goes way, way, way down. So unlike the investment bank where you needed an initiative to keep people through the first 2 years, your initiatives only need to be about 3 months long. If you can keep someone there for 3 months, the chance of their turnover goes way, way down. Then if you can keep them through 6 months, you're pretty much set after that point. So this was not a new problem. This problem has kind of always existed in long-term care. In 2019, we were losing about 30% of our new hires before day 100. And then in 2020 and in 2021, the pandemic has really emphasized this problem, and it's gone from 30% up to 39%. So we're losing almost 40% of our new hires before day 100. But the good news is there are some things we can do to fix this. We don't have to keep people for 2 years. All we need to do is focus on the first 100 days. And there are some strategies that the data has said these have proven to work, some of these strategies. And so how do we fix this problem? How do we fix this turnover problem in our sector? Well, the first thing we need to do is we need to have a strategy to keep our people. We need to keep our staff with us for 100 days. And if you can keep your people for the first 100 days, you're going to see huge results in employee retention. So the rest of today, I want to talk about some strategies of what you can do to keep your people with you through the first 100 days. So thriving in the first 100 days, there's 5 things that we recommend that you do. The first one is to create your 100-day strategy. So you have to create a specialized strategy. These are 5 things that we recommend, but your strategy can look like anything you want it to look like, as long as you are creating a strategy. The other things we recommend is to really focus on onboarding and training, and I'll give you some tips on how to do that. The third thing is to get systematic feedback from your new hires, check in on them, see how they're doing. Fourth is recognition. It's a very important thing. And then the fifth one is more of a strategy. It's less tactical. These other ones are tactics that you can implement immediately. The fifth one is creating a culture of love. And we'll talk a little bit about that, what that means. And that's something that you cultivate and you build over time, and it will create a culture that your staff can thrive in and will eventually lead to a lot less employees calling out sick, or calling out, not necessarily sick, a lot less employees missing shifts and a lot lower turnover. So first of all, creating your 100-day strategy. The first thing that you want to do is you want to set expectations with your new hires about the first 100 days. One of the things that I highly recommend is that you work with your HR and your onboarding that every person who gets hired, that they understand how challenging the first 100 days are. That you tell them upon hire that, okay, there's a reason that you took this job beyond just the pay. There's probably something you're wanting to get out of this job, and let them know, have them tell you what it is. Well, we want to let you know that during your first 100 days, you may not feel that. You may not feel that sense of satisfaction or that sense of purpose that you're trying to get out of the job, because there's a lot to learn in the first 100 days. You're going to be learning new systems. You're going to, there's some, you have to learn about the shifts and the shift leaders, and there's culture. You have to learn our mission. You kind of have to learn, sometimes you have to learn the politics of a new place. You got to understand how things are set up. There's a lot to learn, and it can be kind of feel like getting thrown into the lion's den. But the good news is we have processes in place that are going to help you through those first 3 months, those first 100 days. And if you can if you can last through the first 100 days, things get much, much easier. You're really going to enjoy the job a lot more. You're going to get a lot more satisfaction, and we're going to be here to help you. So this is very important. Set expectations with your new hires about the first 100 days, because like the graph showed earlier, the chance of them leaving before day 100 is very high. And so you need to educate them on that and say, sometimes it's not going to feel worth it, but if you stick with us, you're going to get the rewards, and it's going to eventually pay off. Come talk to us if you ever have any problem in thinking about leaving. Okay, the next thing is, you need to be measuring how many of your employees stay through the first 100 days. So all you got to do is you got to count your new hires, and that's going to be your numerator, and your denominator is going to be how many people stay, or how many people make it to 100 days, and that's going to give you a percentage. So we're looking at how many hires we have and how many of those new hires make it to day 100. We're looking at a percentage of people that make it 100 days. The national benchmark there is about 60%, because like I said, 40% of new hires are leaving before day 100. So if you start tracking this measure, this should be a KPI that you're looking at. If you're trying to reduce your employee turnover, the best place to start is by reducing your 100-day turnover. So you need to measure that number and say, okay, the benchmark, or not the benchmark, but the national average is about 60% of new hires make it to day 100. We want to outperform that. So we're going to set a mark. Maybe we want to get to 65, 68%, something like that. And then we're going to set a goal to increase our 100-day retention. This is something you can start doing immediately. You can look at how many new hires we've had in the last year and how many of them made it to day 100, and get your percentage going and start looking at this, set a goal to improve it. We recommend that you assign a team leader to oversee this initiative. Have somebody this is one of their KPIs in your management team that they are looking at. It's probably falls under an HR function, and HR can report it into management, but some people have their operations staff or their management staff, maybe even administrative staff owning this metric. And so we're creating a strategy. We're creating something that we can measure. In order to have a successful goal, you need to measure something. So you've got to measure how many of your employees stay with you through the first 100 days. If you need help with any of this, I'm happy to help. Any of us here at Pinnacle are happy to help with this. We can get you set up on this. It's pretty easy to start measuring. We can give you some tips on how to measure. Okay, so number 2, after you create your strategy, is you want to start focusing on onboarding and training. No day is more stressful than your first day. Okay, so we have a bunch of questions that we ask to new hires and that we ask to existing employees through our retained platform. We do these surveys through this platform. And of all the questions we ask, the number 1 correlator to staff tenure is how well they rate their onboarding and training. The higher they rate their training, the more likely they are to have longer tenure. The lower they rate their training and onboarding, the more likely they are to have short tenure and leave. So according to statistics, one of the most important things you can do to improve and increase your staff tenure is to improve your onboarding and training. And the only way to measure your onboarding and training is by asking your employees to rate the onboarding and training. That's one of the reasons the next thing is so important, which is systematic feedback. We want to get feedback from our employees and from our new hires where we're asking them how things are going and they can let us know. One of the things we want to ask them is, how is onboarding and training going? And they will let you know. So I get asked all the time when I do these sessions, what's the appropriate amount of onboarding and training? And I really can't answer that. There's not a global amount that says 2 weeks is the amount of onboarding and training that will work for everybody, because everybody's facilities are a little bit different. Everybody's systems are different. Everybody's training policies are different. And the only way you can find out is by asking your existing team members that have gone through the onboarding and training how effective it was. They'll tell you. And you can, if they tell you it's ineffective, they will give you ideas of how to make it more effective. This is, we are a feedback company. When it comes to onboarding and training, feedback is so important because you are able to, that's the only way you can figure out if it's successful or not. Like I said, during onboarding and training, that's when we go back to some of these things like setting expectations with new hires in the first 100 days. All of these things kind of work together. And so during training, we want to let them know, the first 100 days are a little difficult, but it does get easier. And each day that you're there will get easier and easier, and you'll keep learning and you'll kind of get over this hump. So one of the things that I would like you to ask yourselves is, are we rushing past our onboarding because we're working short, we don't have enough staff, we need these people out on the floor? Are we bypassing some of the onboarding and training just to get them out on the floor? If you're doing that, you're going to create a vicious circle where those people aren't going to last, and you're going to have to find other people to take their place. So you kind of have to bite the bullet. I understand that we do need them out on the floor sometimes, and maybe they can still be on the floor, but shadowing somebody, if you're bypassing, the data is very clear about this. If you're bypassing onboarding and training, you're not going to keep your people. And so you've got to make sure they're getting enough training. The only way to understand if they're getting enough training is to ask them. So this was an interesting stat at the bottom. Employees are 23% more likely to stay if their manager clearly explains their roles and responsibilities. So they need to have some kind of clear explanation about what their role and responsibility are. So that's number 2. Number 3 is a real important key part of all of this, and that's systematic feedback. Checking in with the new hires, seeing how they're doing, asking them if there's anything that you can do for them. What we recommend is that you do milestone check-ins. For example, in our platform, we do a check-in at day 15, at day 30, day 60, and day 90. We also check in with them. We don't ask any survey questions, but we check in and say hi right when they're hired. So we have kind of 5 check-ins, and 4 of them have survey questions where we're asking really short, quick questions. This is not a huge formal survey that has to be tested and structured. We're trying to get individual feedback from each of your new hires about how things are going. So whenever we do our check-ins, one of the first questions we ask is, how's your job going? It's pretty simple. It's just a check-in. How are things going? One of the other questions that we always ask, do you need anything right now to be better at your job? That's a really great question that when you're doing your systematic feedback check-ins, whether you're having managers do it or whether you're using a system like us that does it through technology, you're going to get a lot of great feedback from this question. Do you need anything right now to be better at your job? So that's definitely something we would recommend that you ask if you're not using a vendor like us to check in on your new hires. Just have your managers check in. Do you need anything right now to be better at your job? Make sure they're doing it at specific time intervals. If you don't want to have the managers do that, you don't want to manage the process, it's fairly inexpensive to outsource that to a company like us or to somebody else. So one of the things that you need to make sure that you're doing is when you're doing this systematic feedback, that you tell your staff what you've learned and what you're trying to do to improve. One of the things I get asked all the time is, how do we get more participation in our employee feedback surveys? We're doing an employee engagement survey. We need to get more feedback. One of the best things you can do to get more participation in your employee surveys is to tell your employees what you've learned from the last feedback survey that you did. This is what you learned. This is what we're trying to do to improve it. If they feel like you're doing surveys and then if they're filling out surveys and nobody is following up with them and nobody's learning from them, they will stop participating in those surveys. So it's very important to tell them what you've learned and tell them what you're trying to improve. And then in your new hire surveys, your annual engagement surveys should be anonymous, because everyone needs to have the anonymity to give their feedback. Your new hire surveys, you're just checking in. So these almost aren't satisfaction surveys. They're just check-ins, and they shouldn't be anonymous. You should follow up with those. You should follow up with each individual of how things are going with their job. Do they need anything to be better at their job? And like I said, they can be electronic, or you can do them, just have a manager check in on the new hires. But you have to have this systematic feedback where you're evaluating how onboarding went, how they're doing, if they need anything right now. And those new hire check-ins should not be anonymous, because you want to follow up individually to each of them. There's some trends you're trying to learn from some of the new hire things. Some of our clients have learned, some of our baby boomers and the older generation are having a more difficult time with training. Our millennials, our Gen Z, they seem to be rating training better, but the older generation, they're having a harder time with training. So we need to do some things that are a little more inclusive to the older generation. And that's something you can learn at a global level when you're looking at all of the feedback. But a lot of the feedback from new hires, you're not looking, you can look at the global, but a lot of the important stuff is by looking at each individual. What do they need right now? Because if we can get them to stay with us through that first 100 days, if we respond to their individual needs by what they're telling us they need in those first 100 days, we know we're going to keep them long-term. So what specifically are they telling us that this specific employee needs right now? And so one of the ways that this works is, this can't work from an organization level where it's just HR looking at this. You really need people at the facility level looking at the specific frontline managers who are following up to this type of feedback, because you can't have someone in the corporate office following up to all the feedback from all the new hires. You need people at the facility levels whether it's the administrative team or the frontline managers or charge nurses, whoever it is, somebody who can follow up to these employees' individual requests. Because if we know this is a very good investment, if we can keep them through the first 100 days, we're going to have a high chance of keeping them long term. As a matter of fact, these new hire surveys are so powerful that we know that new hires who respond to a check-in survey are 50% more likely to make it to the 100-day mark. So by doing these new hire check-ins, that we are really improving the chances of them of making it to the 100-day mark. And from what we talked about earlier, we know that if we can keep them through those first 100 days, the chance of turnover goes way down. So we know that the data is telling us we can make a huge impact on our employee retention numbers by focusing on the first 100 days, by specifically focusing on onboarding and training, doing these new hire surveys. If we can get someone to take these new hire surveys and we respond to them, 50% more likely to make it to the day 100 mark. I mean, these are big numbers that are going to really help decrease your employee turnover. Okay, the next thing is employee recognition. And this is really important. One of the things that we recommend, a recognition program should not be seen as something that's above and beyond. Like management, we have our job. We need to make sure we have the right staffing. We need to teach them the protocols. We need to teach them the standards of how we provide care, make sure we hit our clinical outcomes. But all of your managers should feel like recognizing their staff members is a part of their job description. You know, make sure your managers know that employee recognition is part of their job. It's very important. One of the things we recommend, look for things to celebrate. You know, we do customer satisfaction surveys. In those surveys, employees, team members are almost always mentioned by the respondents. They'll always say, oh, we really appreciate Carl in the lunchroom, or we appreciate Catherine, the therapist, or so-and-so who is our nurse in the evening. You know, they were so wonderful. Anytime anyone gets recognized like that, they need to be recognized in front of the team. Recognition is a really, really important part of this job specifically. People are in this line of work to take care of others. And, you know, a lot of times we're choosing a little bit harder of a job because we get a certain reward in our psyche for helping others. And as managers, when we can recognize them for doing that, that really compounds the reward that they're receiving. And they're much more likely to stay with you if they feel appreciated. They're much more likely to work hard and to provide better care when they feel appreciated and recognized. We're trying, you know, we've said one of the things we're trying to do is we're trying to create an initiative to keep people through the first 100 days. Well, once they make it to 100 days, celebrate them. Let them know, you know, that they did it. They made it through the hardest part, and we really appreciate you. You need some type of systematic recognition program. You know, a lot of the things I'm talking about are systematic. I talked about systematic feedback. Training and onboarding needs to be systematic. The strategy, it's a system that we're creating a goal and we're working on it. Recognition needs to be the same thing. It's a system. Employees are twice as likely to be looking for a new job if they don't feel recognized for good work. This is really important. Okay, the last thing, and I'll just touch on this briefly, is about building a culture of love. This is one of my favorite things to talk about. A few years ago, there was a study published by Sigal Barsade and April O'Neil called What's Love Got to Do with It? It was a study of the culture of companionate love and employee and client outcomes in a long-term setting. What they found is that companies that had what they called a culture of companionate love. So when we talk about culture of love, we're not talking about romantic love. We're talking about caring between employees. When the employees have a sense of caring for each other, they scored high in what the authors of this study called a culture of companionate love. Now, Sigal Barsade was from Wharton University. And so this was really an interesting study talking about the effects of love in the workplace and how it affects the outcomes, employee outcomes and client outcomes in a long-term care setting. So what does a culture of companionate love look like? Imagine a pair of coworkers collaborating side by side, each day expressing caring and affection towards one another, safeguarding each other's feelings, showing tenderness and compassion when things don't go well. Now imagine a workplace that encourages those behaviors from everyone, where managers actively look for ways to create and reinforce close workplace relationships among employees. So, creating a culture of companionate love means creating a safe space where employees really care about each other. This is one of the reasons why employee tenure is so important, is because employees that have a long tenure, they start to build deep relationships with each other. When they have deep relationships with each other, there is a huge amount of benefit to the employees and to the residents. So employees who felt they worked in a loving, caring culture, reported higher levels of satisfaction and teamwork. They showed up to work more often. Our research also demonstrated that this type of culture related directly to client outcomes, including improved patient mood, quality of life, satisfaction, fewer trips to the ER. So think of all the boxes this is checking. These are the outcomes that we want to have and in a long-term care setting. And one of the secrets to that is having employees that work in a loving, caring culture. So what kind of policies are you enabling? Are you fostering a workplace where people can have this type of loving and caring culture? They can build relationships with each other. You know, do you have managers? One of the things that we see all the time in this space is you have people that have been there for a long time who are really hard on the new hires. You know, there's an expression that, you know, they eat their young, the nurses eat their young. And do you have that type of culture going on within your facility? Are you protecting your people from it? Are you giving them feedback to these people that have been there a long time that maybe you're not treating some of the other people with very much caring and compassion, that this is very important to client outcomes? Are you we ask our staff to make sure that they're caring and kind and communicating to the residents and to the family members. Are we as management doing the same thing to our staff members? Earlier, we talked about actual angels. What's our attitude towards the staff members? Do we really know that they are actual angels taking care of people? Are we doing everything we can to take care of those people? Are we creating a culture where they can have loving, caring experiences between each other? Because if we create those type of cultures, it will have huge impacts on client outcomes, better patient mood, higher quality of life, higher resident satisfaction, fewer trips to the ER. You'll have workers showing up more often for their shifts. There's a lot of benefit to this. So throughout all of this, the culture of love, here's some of the things that it looks like. It's focusing on the emotional aspect of work. Brene Brown's got a great quote that says, we used to think of ourselves as rational beings who sometimes felt emotion. And now we're starting to understand the human's psyche a little bit better, that we're actually emotional creatures who sometimes reason. And so you have to understand that, you know, emotion makes up a lot of who we are as people, and your staff is going to have a lot of different emotion, and we have to focus on the emotional aspect of work. We have to understand that they've chosen this reason, or they've chosen this profession for a reason. They've chosen this profession because it is emotionally fulfilling to them. It gives them some type of emotional response that they're looking for. If that's the case, you have to double down on that. You have to provide that emotional aspect at work, a positive emotion. If you do not provide this caring culture and you don't provide this positive emotion, you're going to lose your staff. And so the reason that a lot of people have chosen this profession is because of the emotional aspect. Don't ignore it when you're creating your types of culture. Understand that your staff members are craving this. They are caring people. They want to care for others. It's our job as leaders and managers to care for them and take care of them. Okay, so in kind of wrapping up here, we want to keep our staff with us for 100 days. This is really important. If we can meet, this is going to have the biggest impact on reducing employee turnover. So with that, I'll kind of turn it over. We've got just a few minutes for questions, but I'm happy to stay on and answer if there's any questions that have come up. So Shelby, I'll kick it over to you if any questions popped up.
Great. Thank you so much, Chris, for that very informative presentation. So I have one question that came up, and it is, how do we get supervisors and frontline managers to buy into the retention strategy?
Okay, so that's a pretty good question. There's a different, you have different audiences that you can do different things to get them bought in. You know, everyone needs to see kind of what's in it for them to put in one of these, to implement a retention strategy. And sometimes upper management, they really need to understand the ROI of an employee retention program. And a lot of them will know that. But one of the numbers that you can use is, on average, it costs about $4,000 to replace an employee in this sector. And so that's kind of the basement. That's going to be the bare minimum. And so each time we can save an employee, each time we have to replace an employee, it costs the organization about $4,000. So if we can reduce our employee retention, or excuse me, if we can reduce our employee turnover numbers, we're going to be saving the organization a lot of money on employee turnover. There's a lot of things that go into that cost. So for some people, you have to focus on the financial part of it. If we can create a program that reduces employee turnover by 10%, it's going to have X amount of impact on the bottom, on the top line, on our the revenue. And so if we can do that, we'll have an impact on financially. And then the other thing is to get some of the frontline managers bought in and motivated. You need to share what the strategy is, what some of the goals are. Share what the number is that you're measuring, that we're trying to keep people for 100 days. And if we can do this, it's going to just, tell what's in it for them. Well, you're going to have to fill a lot less shifts. You're going to have a lot better continuity of care. You're going to have higher satisfied customers, higher satisfied residents. So many things work a lot better. So you really have to make sure everybody understands what their benefit is from an employee retention plan.
Great. And I think we have time for one more question. So I'll just take one more. The next question is, what are examples of expectations we should set with new hires for those first 100 days?
Okay. That was kind of some of the things that I talked about. The main expectation that you need to set with new hires during the first 100 days is that the first 100 days are difficult. So they need to know right out of the gate that the first 3 months are going to be the most challenging time they will ever have in this job. And so it's okay to let them know that, we have a company-wide goal to try to help all of our new hires last through the first 100 days. And that's our goal, and we want that to be your goal as well. So you're all aligned on this, and let each new hire know first 100 days are challenging and difficult. Once you get past those first 3 months, things get a lot easier and a lot more rewarding. And so just be upfront about how difficult the first 3 months are, and that we see a lot of turnover. Turnover is actually very, very high in the first 100 days. After that, it goes down quite a bit.
All right. Well, I think that's all the time we have for questions. So, Chris, I just want to thank you again for this informative presentation. And I want to thank our audience for tuning in. And just so you know, the Staffing Summit continues tomorrow at 1 p.m. Central. And with that, I think we will end. So everyone have a nice evening.
Okay, great. Thank you.
Thanks. Bye.